Good day, everyone. I'm Dr. C. I'm a consultant pediatrician currently practicing in Thomson Hospital, Kota Damansara. And I'm here today to answer some unusual but very important questions posed by parents. I think my kid might be depressed. I'm really worried, but I don't know what to do. Help. Okay, this is a very serious question, to be truthful. A child who is young should not be depressed in any way, right? They are supposed to be happy by their demeanor. So if there are any kids who are actually depressed or show signs that they are not happy for a long time, it's actually an indication for you to seek extra help. So there might be a few reasons. For example, they might be bullied, right? Or there may be some family stressors recently. All these had to be ironed out. And a child who is actually depressed, if it's true depressed, will really need medical attention urgently. Is it normal for my baby to skip the crawling stage? He's still just sitting up, but not really being able to crawl. Do I have to worry? When we talk about crawling, there are a few types of crawling that you need to know. But there is something called a commando crawl, where you actually move around like that. And there's also a crawling on all fours, means you lift your whole body up and support it by your limbs and start crawling. When you say the baby is only sitting up but not really crawling, at what age are you talking about this? So if you're saying that baby is not crawling, commando crawling by 10 months, then that is probably something that you will need to look into. Crawling on all fours usually starts at about 10 months. Okay. By a 1 year old, if they do not do that, you may need to figure out the reason why and pay a visit to the doctor. There's also a subset of children who does not even crawl at all. These children sometimes only shuffles on the bottom to move around. This is what we call as bottom shufflers. Bottom shufflers do not crawl, and when they reach the time, they may just stand up and start walking. This kind of children will skip the crawling stage. My 11-year-old seems to have problems with his sight. How could this be when none of us parents have to wear glasses? Is this because of the TV or the phone? Short-sightedness is very common. It may not be genetically linked, right? It doesn't mean that if there's nobody in the family has got to wear glasses, that your child will not have one too. So a child may be short-sighted for various reasons. Okay, it could be because by himself he's predisposed to get that. Or there are also some studies that show that if you strain your eyes too much, for example, if you spend too long hours concentrating on something and repetitively doing the same thing for a long time, you may get short-sightedness. Well, the risk is there, although it is not all 100%. My kid is really short. What can we do to encourage her growth? We are scared she kena bully later on. Height is predetermined mainly by three very important factors. The first is genetics. Well, genetics you can't really change that much, because if you come from a short family, the child may be short in the adult height, but that one we can't do much. The second factor is nutrition, which is the very important factor in this day and age. Well, you do see a long time ago people tend to be shorter, and in this day and age, in many countries people are getting taller because nutrition is better now. And the third factor, which is medical illnesses such as hormonal issues like growth hormone deficiency and so on, will also affect poor height gain. That will need further visits to the doctor to assess, and of course it can be treated if it is detected early. My girl is just 9-year-old but she just got her first period. Is this normal, or should I take her to the hospital? For a normal child, a normal girl, usually they do not attain the first menses or first period before 10 or 11 years old. So usually if you start having menses earlier than that, you need to be worried about that. And you need to pay a visit to the doctor also, because there might be certain conditions such as early puberty or hormonal issues that cause a child to begin menses, to have menses so early on. For example, let's say if it's found that the child has hormonal issues, usually the pediatric endocrinologist will suggest certain things to perhaps intervene so that you won't start puberty so early. That's very important for you to have optimal growth and also puberty progression later on. And I think my 6-year-old might have a learning disability. She is starting school next year. So any tips? When you talk about learning disability, the term is very general. So are you meaning that the child is unable to talk? Or is she dyslexic? Or is she dysarthric, means that she wants to talk but has problems with talking? Or any other issues such as intellectual impairment. For a 6 years old to start school next year, I think it's going to be urgent for you to bring a child for an assessment as soon as you can, because she may not have time if indeed it turns out to be a severe learning issue. One of my kids' friends has not been vaccinated. Possibly not ever. I don't want to be a bad mom and not let them be friends, but how do I protect my child? So there's a little bit of paradox here. In fact, this question you should rephrase it. How should you worry about that child who's not vaccinated? So I'm more worried about that person who's not vaccinated. So if your child is vaccinated according to age and has completed all the routine vaccinations and if possible all the optional ones, he should be okay. But you need to look into the other one who's actually not vaccinated and try to get the parent of that child to come forth and to find out why he is not vaccinated. My son has terrible asthma, so I told his teachers that he shouldn't be playing sports. Now his classmates made fun of him. Asthmatic children, well, technically they shouldn't be disallowed from doing physical activities. In fact, you should encourage them to do light activities, not to the extent of causing them to have exacerbation of their symptoms. So in fact, studies have shown that light activities and light physical activities help to promote a better control of asthma. Alright? So you should actually allow him to play sports and to train his lungs further actually. There are certain situations where you can also use an inhaler, alright, prior to the activity so that you wouldn't get very bad exacerbation when you're doing it. That's all that we have today. I pretty much answered everything. But I believe that many of you parents out there do have many more questions regards to the health of your children. Well, if you do have any, please don't hesitate to pay a visit to the pediatrician.